Okay, so let's look today at down glides. We looked last week at up glides. We talked a bit about how to think through coupled and non-coupled movements when we're using them to lock segments, either creating stability by locking from below, called locking techniques, or locking from above, cranial locking techniques. We should take a second just to think about terms. Locking is the term that I will use when we are talking about using non-coupled movements fully through the available range of motion to try to lock or fixate a segment and not allow it to participate in whatever movement we're doing with our mobilization technique. Sometimes we don't necessarily lock, but we try to create stability. One example might be flexing through the lower cervical spine when trying to move the upper cervical spine, say in a flexion rotation test. That's not locking the mid and lower cervical spine so much as it's creating stability just through ligamentous tension. It serves a purpose to use those words in a way that's not interchangeably so as to avoid confusion. So that's how we'll use it in our videos, that's how we'll use it in lab, and I'll encourage you guys to create some distinction there in your own language. So we'll use down glides just to review the mechanics of that. If we're going to down glide, let's say C4 on C5 on the right side on Maggie's neck here, well, what we're doing is we're trying to take C4 and we're trying to create extension, right side bending, and right rotation. To take that inferior articulating facet of C4 and glide it down on the superior articulating facet of C5. When we go to do that, segments below C5 want to come with us. So we think through it in the same way we thought through previous techniques. The rotation component is right rotation. The side bending that is non-coupled with right rotation in the mid to lower cervical spine is left side bending. So we can take C5 and we can produce left side bending and continue that down through the CT junction. And then if we counter side bend C4 to the right and we create that fulcruming there, bias extension, and a combination of side bending and rotation to get to the barrier, which is right there with her. So again, thinking through ways of creating stability, locking through the mid to lower cervical spine using non-coupled mechanics. We can do the same thing with cranial locking as we did with the up glide. Saying, okay, we need C3 on stable on C4. We can use non-coupled right side bending, left rotation down to C3 on C4. And then with our contact on C4, bias extension, right side bending, right rotation. And we can engage a barrier there if we wanted to create cranial locking to focus our technique at C4-5. Okay, not dramatically different than what we did before, but maybe just different ways of thinking through it so that it starts to make sense.